Hello, I am Commissioner Emma Darnell. Welcome to Mighty Five Conversations. Conversations is a monthly information and communication program focusing on the sustainable community, economically strong, environmentally safe, with liberty, justice, and opportunity for all. The topic for today is the 2014 Fulton County Legislative Package, What's Going On? Thank you for joining us. I will be back in a moment. Joining me in the conversation today is Christopher Boyd, who is the Grants Procurement Officer in the Department of Finance, and also the liaison between the Board of Commissioners and the Georgia General Assembly. Welcome, Mr. Boyd.
Thank you, Commissioner, for having me.
We are so happy to have you today. We want to talk about certain parts of the legislative package that were introduced in this session of the Georgia General Assembly, because there's strong interest, particularly in the legislation that relates to health.
Yes, ma'am. There was several bills that went through this year that deal with the Affordable Care Act. This board has supported the Affordable Care Act, has supported the full implementation of the Affordable Care Act, and has supported the expansion of Medicaid. However, that's something that the governor of Georgia and unfortunately the General Assembly doesn't share. And they've passed some bills that have made it harder to implement the Affordable Care Act and help Georgians get health care.
Let's talk about those bills.
Yes, ma'am.
All right, let's talk about the first one, which I think we refer to as the ACA, Affordable Care Act, Non-Compliance Act.
Yes.
What's the content of that one?
A lot of people may have heard of this bill as it started out. It was called HB 707, the Affordable Care Act Non-Compliance Act. It got moved around a lot to some different bills, and finally it passed with late in the session on House Bill 943. And what this bill does is it prevents the state of Georgia, or any political subdivision, that's our cities and counties, from advocating for the expansion of Medicaid.
What does that actually mean?
That means we won't be able to expend any type of resources here at the county or to expand Medicaid, to request the expansion of Medicaid, to advocate to the people for the expansion of Medicaid. Right now there's over 650,000 Georgians who are being left behind and not getting health care insurance.
Now, does that just really, does that just really relate to the expansion of Medicaid or to just ACA in general?
Well, there's two parts to it. There's the expansion of Medicaid, and then there's also a prohibition on cities and counties, along with the state, from operating the health care exchange.
Yes.
So now,
and Navigator programs too, right?
And the Navigator programs too, and this is really important with the University of Georgia. They have a Navigator program that they run and through their extension offices, and they're one of the few organizations that really has a statewide presence. They have offices in every county of the state, and they have the ability to help people navigate through the exchange to find private health insurance through the Affordable Care Act in order to deal with special situations. You can go on healthcare.gov and sign up, of course, yourself, but sometimes you need some special assistance to understand
Apparently
the terms.
many people do.
There's been big lines. So the deadline was on March 31st, and there were big lines, and we just had the president announce today that they've hit the 7 million goal that they had for enrollment. Even with the problems that they had with the website the first month or two starting out, they were able to rebound and come back and hit 7 million people to sign up for health insurance.
Maybe we need to refresh the memory of the public about what ACA really is. Sometimes it's referred to as Obamacare, but it is health insurance made accessible to groups that never had the opportunity to have health insurance before.
That's correct. If you don't get health insurance through your employer, you have the opportunity to buy health insurance through the Affordable Care Act website. For 36 states, the federal government does it on healthcare.gov, and then in about 14 states, like California and New York, they have their own websites to help people get covered.
And isn't it also true that in the event that you may not be able to afford private insurance, that there is a provision which allows the government to subsidize your plan so that you are able, if you meet the eligibility requirements?
That's correct. So depending on a sliding scale, starting at about 100% of the federal poverty level up to 400%, there is a sliding scale of subsidies that are available and a maximum out-of-pocket cost that you can be charged for a total year. It gets rid of lifetime limits, so you don't have a 1-year annual cap or a lifetime limit. It gets rid of any prohibition on pre-existing conditions, and it closes the donut hole for seniors so that they can afford their prescription drugs, and among many provisions that are in the Affordable Care Act to help people buy insurance.
Well, we've had health staff on to talk about ACA, but I thought perhaps we better refresh everybody's mind with respect to what this insurance actually provides. So the real effect and impact of this legislation is that in Georgia, at least, it's against the law for any state or city to help people gain access to this insurance. Is that an overstatement of this legislation?
It's certainly going to make it a lot harder. We'll have to be very cautious in how we help inform the public on what they can get through the Affordable Care Act and what actions we can take with county resources.
We've made extensive use of the Department of Cooperative Extension and their Navigator program in developing information for the residents of Fulton County about the program. And the Cooperative Extension program has received very high marks from people in terms of the quality of their work. Now, will this legislation prevent Cooperative Extension from conducting those sessions in the future?
Yes, it will. This legislation will prevent them from running their Navigator program or accepting federal funds. The current grant that they receive from the federal government is grandfathered in, so they can finish the grant this year. But next year, I believe this fall, when the next open enrollment period comes open, I don't believe the extension services will be providing any navigator help going forward.
So the federal law is the law of the land with respect to this insurance. However, here in Georgia, what we've done is to adopt legislation that would prevent any state or city from developing information to its citizens about the program.
That certainly appears to be their intent, and that is going to make it a lot more difficult for us to help our constituents here in Fulton County. In order, we had 74,000 people could benefit from Medicaid expansion here in Fulton County, and it certainly is going to provide a lot more obstacles to us helping our constituents get health insurance.
What about that exemption? There's something that says something about an exception for a public official who would advocate as a part of their regular duties and as public policy. Is that just an out for?
It's certainly.
Is that language that's intended to certainly not put an elected official in a situation where they cannot disseminate information to their constituents about a federal program that they paid for, that they need?
It certainly does give an out in terms of official duties, but
That's narrow, I bet.
Very narrow, and it would seem to be more about public officials recommending to other public officials, recommending to the General Assembly.
I see, not to constituents.
But not to advocate to the public on that behalf. So it did not seem like it gave a very wide exception.
So if I attend a community meeting and a constituent asks about the benefits and the procedures that are needed in order to participate in this program, if I give that information, would I be subject to some kind of penalty?
Well, not you as an individual. you would have that ability as an individual, whether you're a commissioner or a private citizen. If you
I
want
guess
to.
the First Amendment is there in there.
First Amendment is still
Little
there,
pesky Constitution there.
but in terms of spending tax resources,
I
the
see.
county's resources
That's what it's about,
to
isn't it?
produce a wide amount of information and disseminate it to the public, that would be restricted.
So as long as I develop my own materials with my own money, then I can distribute the materials, but I can't use any county facilities to develop information that could be useful to working families who are eligible for this insurance.
I'm afraid that's how I read this law.
All right. All right, I understand that we're going to have to take a break right here, Mr. Boyd, but when we come back, we're going to talk about that part that has to do with the expansion of Medicaid. I'm afraid it's still going to be bad news. We'll be back in a moment. Mr. Boyd, we were saying earlier that the action of the legislature relating to this whole federal health insurance, we call it the Affordable Care Act, ACA, involved not only this matter we just discussed about penalties for even telling folks about it, but also it included the request by many, and in which we supported, that we would expand, the state of Georgia would expand Medicaid so that those people who are not eligible for Medicaid would be able to participate in this insurance. And of course, that didn't go well either, did it?
No, it didn't.
Tell us about that.
Currently under state law, the governor, through the Department of Community Health, has the authority to expand the eligibility of Medicaid, to redefine what the income limits are, so that people could join Medicaid under the expansion that's being provided by the federal government. For the first 3 years, the federal government pays for it 100%. And then going forward, it pays about 90% afterwards. But the General Assembly passed a bill, this bill HB 990, that would put limits on the governor's authority to expand Medicaid. It would require approval of the General Assembly through a specific act. So if the governor changed his mind, if the governor had negotiations with the federal government to do a different program like has been done in some states such as Iowa or Ohio or Arizona, where they've actually taken these expanded Medicaid dollars and moved people into the exchanges. Right now, if you're below 100% of the federal poverty level, you're supposed to go into Medicaid as part of the expanded Medicaid.
We're not talking about that group.
You can't go into the exchange.
Yes, you can't go into it.
Cannot.
Yes.
So
if you have Medicaid, you don't even go into ACA.
that's correct.
And this is designed to get that group, those poor, those working and poor, but they are a little bit higher and don't really qualify for Medicaid. Is that
That's
correct?
correct.
Yes.
For a family of four, it would be about $22,000 a year in income that they're trying to survive on. But they can't get health insurance through their employer, and they now will not be able to get it through the exchange. So it's really a gap the way this is working.
Some folks say that is the real tragedy about folks who live in states like Georgia that have not expanded, and that is that one of the main purposes of ACA was to get that group. It was to get that group, though poor, for a family of four with $23,000, are not eligible for Medicaid. Therefore, they have no insurance.
That's right.
And they're working every day. And this is the group, according to legislative history before the Congress when they adopted it, that really was targeted. And here in this state, though, based upon this action, this group will not be able to participate.
That's correct. They're going to be left behind without any expanded health insurance whatsoever. They won't be able to participate in the exchanges because they make too little money, and they won't be able to get Medicaid expansion. If you are a childless adult, you basically cannot get into Medicaid And most,
if you make 23,000 and above.
or actually, for a single individual, it's only
It's
about,
less than that, isn't
it's
it?
like 2,300.
Yes.
It's, for a single mother, if she makes more than 9,500 in a year, she can't.
9,500 a year.
Yes,
She can't get Medicaid.
that's
And
correct.
if she lives in Georgia, she cannot get the benefit of this this insurance. Is that right?
That's correct. The Harvard Medical Journal came out recently about the end of January, and it stated that there would be between 550 and 1,100 needless deaths in the state of Georgia because of the
Wow.
Medicaid expansion. We know that getting
That's serious.
health insurance prevents people dying.
Oh, access to health care, and you only have access, really, if you have insurance.
That's correct. Or you just go when you have an absolute medical
And it's too
emergency.
late.
And it's too late. So that's going to be happening and continue to happen for every year that the state of Georgia does not expand Medicaid.
So we're not just talking politics, we're talking life and death, aren't we, Mr. Boyd?
Yes, ma'am, we certainly are. And that for just not only the state of Georgia, but for about 25 other states, about over almost 5 million Americans who would qualify for Medicaid and are being left behind without health insurance. And they're going to our safety net hospitals, they're going to Grady Hospital, and there were programs in the Affordable Care Act that were designed to save some money, things that were designed for our safety net hospitals because there was going to be less uninsured. And so they're getting a double hit. They're going to be hit with the loss of those funds, as well as they're not going to be able to have their patients have health insurance and be able to pay.
Meanwhile, counties like Fulton County do not have the resources to even begin to make up that gap.
That's correct.
We have 40,000 people. You said 70,000, but I heard a figure of 40,000. That was some time ago. Your figures are perhaps more
I
accurate.
think that may just be it goes to Grady Hospital. It may not
Yes,
be
that
all
must
of,
have been Grady, yes, their estimate. And our resources are declining, and of course the opportunity that Grady had to receive additional assistance is gone. And of course the DISH funds.
that's the program that's being
Yes,
reduced.
It's been reduced
And it's happening to Clayton County with Southern Regional. It's happening to
all over the nation.
rural hospitals. We've had
Closures.
4 closures in the last few years, 8 since 2000. So there's a lot of hospitals closing because they don't have paying patients. And so they have no choice but to close. And without Medicaid expansion, there's no opportunity for some of these hospitals to receive those expanded revenues.
Well, the Board of Commissioners voted, I believe it was unanimously, to support the expansion of Medicaid. I think citizens would like to know, what about our delegation in the House, Fulton County delegation? Did they support the expansion of Medicaid?
They did not, although it was split along party lines. Right now, the delegation is basically a 1-vote majority on each side, both House
Just
and
one
Senate.
vote? I thought it was 2 or 3 on the Senate side, but not.
It depends on whether or not we're talking about Atlanta or whether or not we're talking about just Fulton County, because there's a portion.
Fulton County
Yeah,
is what I'm referring to. Just a 1-vote margin
right.
in both.
And then, so by that same party lines, they voted in support of these 2 bills that we've been discussing, the Non-Compliance Act and to put limits on the governor's authority to expand Medicaid.
Board of Commissioners, we are nonpartisan. We don't vote by party. Maybe we need to explain. It is a little different, though, with our delegations. Folks, that membership is divided according to party, right?
That's correct.
Mm-hmm.
And
There's a Republican caucus and there's a Democratic caucus.
that's correct. And then within cities and counties, there's a local delegation made up of those members.
Yes.
And based on the majority vote of those members, controls local legislation going forward.
I see, and I think maybe I should be specific. I'm referring to local delegations. I'm referring to the delegations which Fulton County residents elect
That's correct.
to each house. With respect to our local delegation in the House, How did they vote on the expansion of Medicaid?
They voted 13 to 12 against expanding Medicaid.
That's what you were referring to earlier.
Yes,
So
ma'am.
there were 12.
12 Democrats who voted. The actual
What was the bill?
the actual bill was this limit on the governor's authority. It was not.
Yes, it was the
not-
limit on his authority.
It was not an actual vote to expand Medicaid.
Mm-hmm.
It was actually to add more obstacles.
Some people think by removing that authority from the governor, that in effect was a denial of the expansion of Medicaid, because it would be much more difficult legislatively for the General Assembly to approve the expansion than for the governor to.
Yes.
But of course, that's somebody's interpretation. So because the local delegation is controlled by Republicans, and because in the state delegation, votes are along party lines,
Well, this one was for sure.
this one was. I would like to see one that wasn't, but I guess maybe the statute of Dr. King. I understand that one, that passed, not along party lines. So what you're saying there, Mr. Boyd, is that the opportunity which we had in Georgia, which other states had also, to make this particular legislation and this benefit, I guess I should call it, available to the working poor was lost during this session because of the adoption of the limits on the governor's authority to expand. Is that correct?
That's correct. And so not only will he not have the individual choice, but he really won't have the ability to negotiate with the federal government to come up with alternatives that expands Medicaid to the working poor, that expands it in some other form, perhaps, to help people get health insurance.
Thank you very much, Mr. Boyd. Certainly with respect to this particular area, the legislative action of the Board of Commissioners, our goals were not met during this session, and we certainly hope that we'll have a better performance by the legislature maybe at another time. Thank you so much for coming in to share, just focusing on this legislation. There's a lot of interest in it for obvious reasons. Thank you so much, Chris.
Thank you, ma'am.
We appreciate it. I'll be back in a moment with closing thoughts. Stay with us. Healthcare and access to quality health care is one of the most important factors that determine a person's ability to live a high quality of life in the metropolitan Atlanta area, according to a recent study regarding income disparities. The record also indicates that over 1/3 of the county's 2014 budget has been allocated for the delivery of healthcare services, including $61 million to Grady Hospital for services to Fulton's indigent residents. For these reasons, we are disappointed that the Georgia legislature did not expand Medicaid to meet the needs of many uninsured working families of Fulton County. That's all the time that we have for today's conversation. Until next time, stay strong. To learn more about today's conversation, contact me at 404-612-8222. You can also email me at emma.darnell@fultoncountyga.gov. Visit us online at emmadarnell.com or connect with us on Facebook or Twitter.